Shocking health news for pop singer Selena Gomez. The 25-year-old getting a kidney transplant to help her fight with lupus. In an Instagram post, Gomez called the transplant, quote, "what I needed to do for my overall health." Now, the donor kidney is coming from a television actress and friend. A photo of Gomez and her donor friend holding hands while lying side by side in hospital beds. Gomez revealing her lupus diagnosis in 2015. So we want to go beyond the headlines today. Dr. Joseph Singh is here. He is a transplant nephrologist from Hartford Hospital. Good morning to you, Dr. Singh.
Good morning.
So we're learning more about this just because it is in the spotlight with Selena going through this. What exactly does lupus do to our organs? Is it just the kidney that could be affected, or are others also susceptible?
So lupus is a systemic disorder that can affect multiple organs in the body, but oftentimes 50% of these people develop kidney problems of various severity.
So this is not a surprising diagnosis for people in your community or other people that perhaps live with lupus. For us, we're hearing this and it's like, my goodness, this is really, really serious. What's super important, obviously, we hear about this all the time, is the need for donors.
Right. The volume of cadaveric or deceased donors is relatively fixed year to year, and we can predict what that is. And so the only way we can meet that increasing gap between need and availability is to have more live donors who are able to participate in the transplantation process.
And with the kidney, that is an organ that can be taken from a live donor. Obviously, that's not always the case with all the different donations that are needed. So what exactly would the prognosis be here if this is successful and this goes through for a patient like Selena Gomez dealing with lupus and damage to her kidney? What kind of prognosis would she have after the surgery?
That's a great question. She's a young individual, and oftentimes we quote prognosis or survival at 12 years. But if things are good in terms of her overall health, perhaps longer than that.
Oh, well, we certainly hope so for her and for everyone else dealing with this. Talk a little bit about the Hartford Hospital program and the donor program that goes on there. Sure.
So we have a lot of professionals at the program who are working to help people go through donation and educate them on the risks and obviously help people in need. We have a lot of different options in order to help people go through the donation process, and even if the person is not a match for their friend or loved one, we have programs that enable swaps or chains so that we can still facilitate the transplant even though they can't donate directly.
Probably a good conversation to have if you've wondered about donating. I'm an organ donor. I have friends who've been recipients of organs. It's really probably something that we need to get into the spotlight. We need to talk about. The need is great, and if we can give it, why not?
Absolutely. I think signing up for organ donation with your driver's license is certainly a great step towards helping alleviate some of that need. And then if you do feel comfortable or willing to go through a live donation process, we certainly have people who can help counsel and educate you about the process.
Dr. Singh, thank you so much. And we had that number on our screen. It's 860-972-4219 with any questions or any more information you want on organ donation at Hartford Hospital. You can give that number a call and find out about their transplant program. And you can read more about Selena Gomez's surgery and share the information with your friends. We've got it all right there. Head to our Facebook page. Look for NBC Connecticut.